Joint replacements, you're just concerned about any issues with their pulses, any issues with, anything related to positioning in the operating room, their mobility coming back. So those are things that we're looking at. The new hospital is so nice, such an improvement for us for our working conditions. Since the hospital's connected, last time we were here we had to send patients from another building to the PACU or pre-op, which was very challenging for us sending patients back and forth. This time there's an elevator for us to just get the patients up one floor, so easier access if we need to run up and see a patient or get somebody down to the pre-op area in a hurry. Also, it's so nice that it's air conditioned. The quality of working conditions is so much better. I'm happy that we're able to amp up the amount of patients we're going to be able to do. I have the A team with me, so we're going to do fine in PACU, even though we'll be very busy. It's going to be a couple long days, but we're all doing great, and the patients are rock solid stable.
Yeah, it's all connected, I checked.